This is the Chronic Disease Fact Check. 7 out of the top 10 causes of death in the United States are caused by chronic diseases. The leader is heart disease at 23.5% of total deaths, followed by cancer at 21.3%. Then we have chronic lower respiratory diseases at 5.7%, stroke and cerebrovascular diseases at 5.2%, Alzheimer's disease at 4.3%, diabetes at 3%, and finally kidney disease at 1.8%. Now let's take a look at each one by the numbers. Heart disease is also known as heart and blood vessel disease. It includes many problems that occur as a result of atherosclerosis, which is a condition caused by the buildup of plaque in the heart's arterial walls. When plaque builds up, there's less room for blood to flow through the arteries, inhibiting the normal processes of the heart. In some cases, blood clots form, blocking the flow of blood, leading to heart attack or stroke. One of the largest risk factors? Obesity. Now let's look at cancer, because it can develop anywhere in the human body. It occurs when excessive cell growth happens, crowding out normal cells. Apoptosis is programmed cell death, and cancerous cells are able to evade apoptosis and continue growing, even traveling to other parts of the body and wreaking havoc wherever it lands. Risk factors here: smoking and tobacco, diet, lack of physical activity, excessive exposure to the sun and other types of radiation, viruses, and other infections. All right, now let's look at chronic respiratory diseases. Now, these are commonly referred to as diseases of the airways and other structures of the lungs. Now, there are several types of chronic respiratory diseases, including COPD, chronic obstructive pulmonary disease, asthma, pulmonary hypertension, and occupational lung disease. Now, COPD is a term used to describe progressive lung diseases, including emphysema, chronic bronchitis, and non-reversible asthma. COPD is characterized by increasing breathlessness. Asthma occurs when the airways get inflamed and narrow, making it difficult to breathe. Pulmonary hypertension is a type of blood pressure that affects the arteries in the lungs and the right side of the heart. Occupational lung disease is caused by repeated and long-term exposure to irritants on the job, such as smoke, dust, mold, and others. Risk factors here: cigarette smoke, other types of tobacco smoke, secondhand smoke, air pollutants, chemical fumes, dust, and respiratory infections. Now, stroke and cerebrovascular disease are both diseases that affect the blood vessels and blood supply to the brain. Any types of blockages, malformations, or hemorrhage that prevents the brain cells from getting enough oxygen can damage the brain. Now, the verbiage you may recognize would be stenosis, vessel narrowing, thrombosis, clot formation, blockage or embolism, or blood vessel rupture, hemorrhage. Lack of sufficient blood, ischemia, affects brain tissue and can cause stroke. Risk factors here: smoking, high blood pressure, carotid artery disease, diabetes, high blood cholesterol, obesity, and hormone replacement therapy. Alzheimer's disease, the most common type of dementia, nearly 60 to 80% of all dementia cases. Dementia refers to a group of disorders that lead to memory loss or the decline of cognitive ability. Alzheimer's is a progressive disease, meaning that it worsens over time. There is currently no cure for Alzheimer's. Risk factors would include age and genetics. Now, women living longer than men are more affected. Family history and genetics, previous head trauma, poor sleep patterns, lack of exercise, obesity, high blood pressure, high blood cholesterol, and smoking. Now, diabetes is a disease that occurs when your blood glucose levels are too high. This is caused by a lack of insulin or impaired insulin function. That's the difference between type 1 and type 2 diabetes. Now, what you need to know about diabetes is the role of insulin. Insulin is the most anabolic hormone. Anabolic means to build. The glucose in your blood needs insulin to get inside your cells. Therefore, the anabolic effect of insulin is its uptake of glucose into the cells to be used for energy. Here are the differences between the two. Type 1 diabetes is known mostly to originate in children and teens. Here, the body's immune system attacks part of its own pancreas. The insulin-producing cells are seen as foreign invaders, targeted and then destroyed. Without insulin, the blood sugar levels raise, causing damage to the eyes, kidneys, nerves, and heart. This can lead to coma and death. Now, type 2 diabetes is commonly referred to as adult onset, typically developed after age 35. Diabetics with type 2 are able to produce their own insulin. The problem is that the insulin function is impaired. You may hear it referred to as insulin resistance, as it won't let the glucose in, which can also lead to excessive blood glucose levels and the same dangers as found in type 1 diabetics. Risk factors here: genetics, viruses, lack of physical activity, poor diet, and obesity. Now, kidney disease is also known as CKD, chronic kidney disease. It's characterized by a loss of your kidney's ability to function properly. And in case you didn't know, the kidneys are designed to maintain the overall fluid balance in the human body. It regulates and filters minerals from our blood, filters waste materials from the food we eat, medications we take, and toxic substances we intentionally and unintentionally consume, such as alcohol. Risk factors would include diabetes, high blood pressure, smoking, obesity, genetics, lifestyle, and heart disease. Now, I'm not giving you these explanations and causes just because. I know many of you are already aware of the seriousness of all these conditions. The reason I'm sharing this information with you in greater detail is because I want you to understand how preventable most of these conditions are. What do most of these causes have in common? Exercise and diet. Let me ask it another way. What are the most common similarities of the leading causes of death in the United States? Lack of exercise and a poor diet. All right, let's try this again. What are two of the most common ways to prevent the development of chronic disease? Through diet and exercise. Specifically, a healthy diet and plenty of exercise or physical activity. Look, I know personally how chronic disease can affect families. It's affected mine for as long as I can remember. Many of you can probably relate with that, but it doesn't have to be like that. You don't have to suffer. Your family and friends don't have to suffer. It's the why and the how that we're focusing on that will help you feel confident sharing your opinion and expressing your feelings. So let's look at the solutions. Here's a chronic disease action plan. Lower cholesterol. Control blood pressure. Maintain a healthy weight. Eat a balanced diet. Exercise regularly. Stress management. Healthy sleep habits. Quit smoking. And limit alcohol use. Now, these solutions are not new. You've heard them before. The fact of the matter is that many of these solutions have required more energy and effort than you've been able to give, or even that you've been willing to give. And it's not that you didn't always want to, you sometimes didn't feel like it. You weren't able to. Maybe you didn't understand how. Maybe you didn't have the support. What we're going to do now is get to the next level. This is where you understand that in order to prevent the above, it's going to require your commitment. The heart disease, cancer, CRD, stroke, Alzheimer's, diabetes, and kidney disease doesn't need to be in your story. You can change the narrative. You can change it for you and the ones that you love. The patterns that you set now, they don't just influence you, but they also influence your children who look up to your guidance. See, we're only targeting obesity. We're just wanting to decrease the risk of developing chronic disease, and a lot of the same strategies that are employed to help prevent and treat obesity are the same ones that we can use to help prevent chronic diseases.